Namaste, my dear brothers and sisters. The love and blessings of the Mother and Sri Aurobindo to all of you. In 1990, the famous American cardiologist Dean Ornish made waves when he published a popular paperback titled Dr. Dean Ornish's Program for Reversal of Heart Disease. What exactly did he mean by reversal? What he meant was that when he gave a yoga based lifestyle modification treatment to patients having coronary artery disease, there was a measurable reduction in the degree of narrowing of the coronary arteries in just 1 year, and still more after a 5-year follow-up, which he published later in 1995 and yet another in 1998. So what did he really mean by reversal? What he had shown in those studies was that if you administer a yoga-based lifestyle modification program to patients having a blockage of the coronary artery disease, which we normally call coronary artery disease or coronary heart disease, then these patients had a reduction in the degree of narrowing, which could be demonstrated angiographically, and which was further supported by an increase in the blood flow, which was supported by PET studies. And he also had control groups in which only the conventional treatment, generally drug-based treatment, because these patients didn't have severe coronary artery disease. Most of his patients had a blockage to the extent of about 40 to 50%. So these patients were put on medication alone without any lifestyle modification, and that was the control group. And this control group, in contrast, had over the same period of time, instead of a reduction in the blockage, an increase in the blockage of the coronary arteries. Now, what was the magnitude of this reduction in the narrowing of the coronary arteries? The reduction was not great. Say if a patient had a 45% block, then if he had the average 4% reduction, which he showed in his studies, then at the end of 5 years, this person had a 41% block. So 41% blockage as compared to 45% blockage, so a 4% reduction. Now, this does not look to be great. But in contrast, the group that received only conventional treatment, that group showed an 11% increase, which means if this person had a 45% block, at the end of the same period, this person now had a 56% block. What was significant about the 4% narrowing was, number one, the contrast between this 4%, which was the result of conventional treatment plus lifestyle modification, and the increase by 11% in those who had only conventional treatment. So the contrast between the conventional treatment and conventional treatment plus lifestyle modification was very striking. In one case, an increase in the narrowing, and in another case, a decrease in the narrowing of the coronary arteries in comparable patients in the same period of time. What was even more significant about this reduction was that it was a paradigm shift. Because till then, what was believed was that we had self-healing mechanisms in the body only for acute diseases such as common cold or diarrhea. These diseases would get all right even on their own, even if we don't give any treatment, because we have potent self-healing mechanisms built into the body. But when it came to chronic degenerative diseases such as heart disease or diabetes, the general impression was that these diseases generally keep getting worse, and under the best of conditions, they may worsen at a slow rate, and almost impossible it was considered that they would even stay the same. Reversal, that is an improvement, was considered something completely impossible. So the self-healing mechanisms were thought to exist in the body only for acute diseases. For chronic degenerative diseases, it was believed they did not exist. But these studies by Dean Ornish established that even for chronic degenerative diseases, in this case, heart disease, there were potent self-healing mechanisms, which, if given the right conditions in the body, which was made possible by lifestyle modification, those self-healing mechanisms could start working and the disease could start reversing. It is not that the disease reversed completely, but the disease started going in the opposite direction. Instead of getting worse, as it did in the control group, which got only conventional treatment, it started reversing, it started going in the opposite direction, it started getting better in those who received, besides conventional treatment, also this lifestyle modification based on yoga. So it was this paradigm shift which was significant. We discovered that self healing mechanisms existed in the body also for chronic degenerative disease, and the magnitude of the reversal may be small, but at least some reversal could take place, and maybe over time there will be further recovery. And this is understandable because these diseases, such as heart disease, are the result of slow accumulation of damage over several decades. And therefore, the self healing mechanisms cannot reverse that completely within a few days, as happens in uh, common cold. In this case, we do need time, but then given the time and the right conditions for the self healing mechanisms to work, even in case of chronic degenerative disease, it was shown that this reversal or this movement in the opposite direction, instead of getting worse, as was believed earlier, improvement was possible. And that's why this was significant. This demonstration that it happened in heart disease was significant. And since then, it has been shown that something similar could happen also in other diseases, such as diabetes, enlargement of the prostate, high blood pressure, and so on and so forth. Thank you.